Okay, so let's start with the sample question. This is what we have taken from the GMC blueprint. So any question that you're going to get in PLAB2 will be divided under 5 headings. So these are the 5 headings. First, where you are. Second, who the patient is. Third, other information you have about the patient. 4, what you must do. 5th will be a special note. So all these 5 headings will be having a significance, right? So all these are very, very important. So when you read the question, make sure you're reading all these 5 points very carefully. You are not supposed to miss anything, right? So let's discuss one by one about all these 5 points and let's see what's their relevance. Right. So first, where you are a foundation year 2 doctor in rheumatology unit. So all the questions you will see, you will be FY2, foundation year 2 doctor, FY2 meaning internship. You are a foundation year 2 doctor in rheumatology unit. So you will be in one unit. Maybe it's medicine, maybe surgery, maybe gynae, maybe pediatrics, maybe A&E, acute medical unit, maybe psychiatry, anything. So accordingly, you have to deal with the patient, right? So do you think it's important to know which department you are in? Yes, it is very, very important to know which department you are in. You should know what's your job in the particular station, and it will be very much helpful if they are giving you which department you are working. For example, you got a patient. Patient is a female patient. She took 40 paracetamol tablets and now she's in the hospital. So you need to see where you are, if you are in the A&E or you are in the psychiatry. So for example, you are in the A&E. Are you going to ask why did she take paracetamol tablets? No, we are not that much interested in knowing why did she take. Why? Because she came to the A&E and our job is to stabilize the patient. Our job is to treat the patient medically. Otherwise she will die because she has taken 40 paracetamol tablets. So our job is to asking about the paracetamol tablet. Did you take it in one go? When did you take anything else with the tablets? Do you have any tummy pain, any nausea, vomiting, any medical disorders, liver problem, blood disorders if you have got? Meaning all the medical questions you need to ask, and all these medical questions will be helpful in treating the patient. So that is your job. That is your job if you are in A&E. But at the same time, same patient, but you are in say psychiatry, so the things will be different. Now it means patient is medically stable. That's why patient is being referred to the psychiatry. So now you will be asking in detail regarding the suicidal history. You'll be asking what happened before, during, after, and detailed suicidal history you can ask. So moral of the story, it's very important to know where you are. For example, like you are in the A&E, and for example you are in psychiatry and you are saying in the end of the station, I'll refer the patient to psychiatry. I mean, does that make sense? You are in psychiatry and you're telling I will refer you to psychiatrist. That doesn't make sense. It means you're not oriented to time, place, and person. So maybe we need psychiatrists that time. So you have to be very, very careful. I mean, so read it very carefully which department you are in. If you are in rheumatology or you are in psychiatry or medicine, it's very, very important. And always you will be FY2. You will be a junior doctor, right? Let's see the second one, who the patient is. Stanley Smith, age 45, has been referred by the GP because of pain in the right big toe. So in this, they will be telling the name of the patient, age of the patient, right? And they'll be telling briefly about the presenting complaint, right big toe pain. So when you know this right big toe pain, you'll be having lots of differential. First is of course gout, but you'll be having other things also in your mind. You have to think about other things like it might be pain in the calf, maybe it might be cellulitis pain. So you'll be asking about fever, flu-like symptoms as well. Patient has got pain in the right big toe. Maybe patient has got any trauma. Patient like just met with a small accident and he had got trauma on the big toe. That might be the reason of pain. So you'll be having few things and you'll be able to make your mind, because when you go in, what you're supposed to do, you're supposed to rule out few differential as well. That's your main job, right? So you can make up your mind outside the cubicle by looking at the question. But sometimes, you will see few of the questions are like, for example, Stanley Smith, age 45, has been referred by the GP with some problem. So they are not telling us what exactly is the problem. So you may not be able to make your mind outside the cubicle. So when you go inside the cubicle, then only you will get to know the problem is pain in the big toe, right? So it depends how it goes. So we have to be very, very careful and read the question carefully and see patient is male, female, and age of the patient. Everything is very, very, very important, right? Now we have to see other information about the patients. In this, they might say none, they don't want to give you much information, but sometimes you will see they are giving us some very important information. For example, they might tell you patient is diabetic. For example, they are mentioning patient is hypertensive and patient is on amlodipine. Patient is having high blood cholesterol and patient is taking statin. Patient is on insulin because patient is diabetic for last 10 years. So they might give you some extra information that might be really helpful in that particular station, but it's not the case always. They might say none, they don't want to give us any extra information. Right, now what you must do, that's also very important. They will be telling you what's your job in this particular station. So for example, talk to the patient, right? Assess him. Assess means you are taking history and you are doing examination. So that's your assessment. Assessment is history and examination. So talk to the patient, assess the patient, and discuss the management with the patient or examiner. So you have to be very careful. You have to see the management is with the patient or with the examiner. They'll be asking only one of this, maybe with patient, maybe with the examiner. But please do not make mistake. If it is mentioned in the question that management with the examiner and you're doing it with the patient, you will not be getting any mark for the management. And if it is with the patient and you're doing it with the examiner, again you won't be getting any mark. So please read the question carefully and see what exactly they have asked. If you will follow the station, only then you will get the marks. Right, so talk to the patient, assess the patient, and discuss the management plan with the patient or with the examiner. Very important. Please do not miss this point. And then there will be a special note. Sometimes they will say simply none, meaning they don't want to give us any special note. But sometimes the special note is there, like patient is worried, patient is anxious, patient is angry. Maybe consent has been taken from the patient. For example, you're taking to someone else, you're taking to the relative. So in the UK, like you cannot disclose anything about the patient unless you have got consent from the patient, isn't it? So you might be getting a special note. If you're talking to the relative, talking to the friend, you might be getting a special note saying consent has been taken. Sometimes they'll say patient has got full mental capacity. I mean, different kinds of special note you might be seeing. So all these 5 points in the questions are really important. Every point has got importance and relevance, right? And when they are dividing the question in 5 headings, it's easy for us to read and it's easy for us to retain the information as well, because you will be having 1.5 minutes to read this whole task. Sometimes you will see task is very small, like you might be thinking this is a very small task and 1.5 minutes will be more than enough. That's right. But sometimes you will see the question is very lengthy, like in counseling or in some ethical station, you might see the question is very lengthy. It's like 1-page question. So in those scenarios, you might get a bit trouble in reading and retaining the information in 1.5 minutes. But don't worry, the same task which you have got outside the cubicle and you're spending 1.5 minutes to read, the same task will be inside the cubicle as well. So if you want to read it again, you can definitely do it. There'll be a small table beside you in the cubicle and the task will be there on the table. So if you want to see the task again, you can definitely do it. Tell the patient, excuse me, I just want to have a look at my task, and just look at the task. And after that, once you have finished reading the task again, say thank you so much for your patience and start again with your history taking. Right, so that's how we have to do in PLAB2, and please be careful regarding all the 5 points of the question. Right, thank you.